So the whole thing about BCP is education. I've written 60 white papers on all different functions. I've published a number of letters in the Townsend newsletter. I've got YouTube channel, and I've got topics on demand. I've got a list of different things that I've done with respect to it because I'm totally fascinated with this particular molecule and its huge benefits for people. It has just some amazing different functions that I'm really welcome your topic suggestions for it. So what is beta-caryophyllene? It's an essential oil common in many spices that alleviates pain, inflammation, anxiety, and metabolic disorders across the board. It's found in thousands of plants. It's found in cloves, hops, cinnamon, hemp, and it's high concentration in 36 species, including hemp. Now, it's a bicyclic sesquiterpene, so it's got 15 carbons, and it acts as a defensive chemical for the natural predators and insects and signaling by plant molecules, actually. Now, there's over 3,800 studies that have been done in pre-med, but there's only 15 human clinical studies right now. So I wanted to mention that this is found in all these different types of herbs, and you see these are all elements of the Mediterranean diet. It's located in all these different substances, and these are all factors that lead to the benefits of beta-caryophyllene in humans, particularly when they're taking in the Mediterranean diet. So here you have the Mediterranean diet, and what the magic of the Mediterranean diet is that it is activating the endocannabinoid system. And then through this activation of these different herbs and spices, and particularly beta-caryophyllene as being the one that's mostly concentrated, then you're going to get a lot of the benefits of beta-caryophyllene, very specifically the CB2 receptor agonist that's going to happen. Now, you cannot get enough beta-caryophyllene in a foodstuff to really supply your beneficial needs, because you'd have to get about 200 to 300 milligrams, and most of these products carry a matter of micrograms or just a few milligrams, but you can get these benefits, and even at low levels, they seem to provide these different benefits very particularly. So this is a great hats off to the Mediterranean diet for the benefits that it offers. So BCP is FDA is approved as a GRAS substance, generally regarded as safe. So it has not, my product has not been specifically approved by the FDA, but it is a GRAS substance. That means it's legal in all respects. And it's legal in Europe as well. And the European Food Safety Authority has it approved at the same time. So you can use it across Europe. You can use it almost in any country of the world. It has no psychoactive effects other than the psycho benefits that can occur with it. Now, safety and toxicity, man, it takes 5 grams per kilogram to damage a rat. So it's huge doses that are required. There's no reproductive effects on conception, gestation, or ovulation at all. And it's anti-mutagenic, preventing DNA damage by mutagens. So it has huge benefits in this way. And it actually enhances the chemotherapy intracellular concentrating effects. Now, one of the avenues of its degradation is through the CYP3A4 system. But this is a idealish view of the metabolism, when in fact it does not practically interfere with almost any drugs. I've not identified any drug that has produced an interference, and the literature has backed me up on this because probably of the multiplicity of connections that beta-caryophyllene offers. So here are the 15 studies that I've identified. And these are human studies, and you see they're topical, there are vapor, they are oral, and there are sample studies, and there are all different variations of different products. They are combined with other ingredients, other terpenes, and other substances. But these are the studies that I've identified thus far for humans, but there's only 15. And yet every article that I read that comes to some conclusion says that this should be studied in greater detail. Now, with regard to CB2 receptors, there are over 100 different pharmaceutical synthetics that are under development for the CB2 receptors in particular. But BCP is available now and has a wide range of effects, and it's FDA approved, but there's no money in it, obviously. So how does CBD and BCP work? And I put these two together because they work in pretty much the very similar ways, working on the endocannabinoid system and on other mechanisms of the body. They're working through all of this list that I have here with receptors, enzymes, transcription factors, transporters, and even genes. That's an important implication that these are working on the genetics and the epigenetic factors of the body, and they're making major changes to the body through the genetics and the epigenetics that are going on. So this is a classic picture that we have of CBD, the number of prominent connections, and I point out some selected targets of note here that CB1 has an inverse agonist, CB2 is an inverse agonist, and GPR, I believe that's a GPR55 is an inhibition, and A2A is also an inhibition. So these are pretty standard, and what I've done is I've reproduced this slide with BCP in it. And so one of the things that I point out here, and this points out the major differences, is that BCP connects up with the PPAR alpha and the PPAR gamma receptors. It's also an activator of the GPR55. So this could offer different benefits and different subtleties in the effects of the product. It also is an activator of the adenosine A2A for pain, and it has no CB1 activity, at least directly, and it has MAGL inhibition. So that's going to inhibit the degradation of 2AG, whereas Β-Caryophyllene and CBD actually work on the FAH receptor, the enzyme, to inhibit the metabolism of AEA. So you're getting a full spectrum endocannabinoid upregulation with Β-Caryophyllene. And I think that holds some of the major benefits for using Β-Caryophyllene in this context. So one of the features that I like to point out is that these powerful cannabinoids are have incredible synergy with respect to all of these aspects of the body. And I've actually documented them in many cases that they are working together and they can balance out the benefits incredibly. Now, there's been a lot of literature showing that full spectrum CBD is the best one to use, and that includes terpenes. And so it only makes sense that BCP should be combined with CBD for the best results. Now, here's an example of a case of CBD in pain, CBD and Β-Caryophyllene. And you see the top graph is their dose CBD at 2 milligrams per kilogram and BCP at 2.2 milligrams per kilogram. And they're getting a level of pain relief on the order of 6 or 7. But when they combine the two, not only do they drop the dose to 1.4 milligrams per kilogram, but they get accentuated pain relief down to 5 or 6, about 5 for the sum of the pain relief. So you get an improvement of over 27%, almost 30% improvement from using these in combination. Now, here's a study looking at ischemia, where the combined effects have reduced the lowest level of ischemic injury occurred with the combination of BCP and CBD in a fairly narrow range. And it produced these results in a stroke type of ischemic problem. So the power of these molecules and the pleiotropic nature of them is significant and can be used to great advantage for those who can take both products at the same time. In addition, I've got this study that shows that in breast cancer and other cancers, not using any THC, that the combination was highly effective in eradicating and neutralizing a triple negative breast cancer. So the synergy is across the board for many different things, and you should be using it to our advantage in many cases if we can combine these two. Now, with respect to THC, what I've seen from, and this is not in the literature, this is my findings, is that THC and beta-caryophyllene, beta-caryophyllene actually enhances the high from THC early on, but later on it increases the metabolism. So some people have advocated using BCP to accelerate their high and get a higher high, or they've been able to reduce their dosage of THC and reach the same levels of benefits that they're exceeding. Or if they're getting a high effect from the THC and they want to get rid of it, they're using the beta-caryophyllene to get off of it and get back to sensibility and coordination of their mechanisms at play. Now, why is this? Why is this going on? Well, it may be related to lipolysis, because these molecules and the THC is actually can contain much in our adipose tissue, and so with lipolysis, you're going to get release of THC, or it could be the magnification of the endocannabinoids from the MAGL and FAH inhibition, or it might have to do with the CB1 and CB2 heteromeres that actually form, because CB2 actually forms a combination factor with CB1 in certain cases, and there could be some interaction. Now, I block out the CYP453A system because that is not a factor for BCP as the literature has supported. Now, there's other foods that can enhance the THC high, and those are mangoes, broccoli, avocado, and grapefruit. And these are foods with beta-caryophyllene in significant amounts. So there may be a correlation there. So these are some of the individuals who have used the beta-caryophyllene with THC. So they have selected decrease their dosage by 30 to 40%, or they've stopped the use of THC, or they use it in coordination with it. And then some people cannot take CBD, but they can take BCP or BCP combination. So there's all manner of combinations that can work. And so rather than dictating any particular regimen, I tell people to try it and experiment with it to find out what works the best for them. So these are the potential applications of beta-caryophyllene, and they are huge. It covers the entire body and all mechanisms. So I can't go through all of these, but I'd love to. However, we're going to concentrate on a few and the focus on just a couple items here. Now, one of the first things I want to point out is there's a lot of misunderstanding about the CB2 receptor. All you hear about online is the CB1 receptor and the psychoactive effects and the benefits of THC, at least from the literature that I've been reviewing on LinkedIn. And that is so far from the truth. First of all, the CB2 receptor is where it's located in the brain, and the exact function of the CB2 is totally misrepresented, I feel, in most of the literature. So the CB2 receptor in the brain encompasses all of these organs in the brain. So you've got the full balance of subcategories of CNS tissue in the brain where it's activated, where CB2 are receptors. Now, they're not in large volume, and they don't come close to the comparison of the CB1 receptors, but they are located on neurons, on glial cells, they are on dendrites, they are in the nerve bodies, and they're all over the place for the body, but they are at low levels and they don't get activated unless there is neuroinflammation. So with neuroinflammation, then they get activated, and then the receptors get upregulated, and then they're begging for an agonist, which is going to be the endocannabinoids ideally, but it also can be beta-caryophyllene as well. Now, the other thing is that the CB2 receptor is located on the postsynaptic side of the neuron. So it's located on the dendrites, not on the axons of the cell. And this is so often misrepresented in the older slide renditions that I see constantly on LinkedIn or being represented. Now, the CB2 receptors are everywhere in the body, and they comprise mostly for immune cells of all types. And they're regulating the immune system very, very specifically in all manner, shape, and form. And so they modulate the entire body, and every body system is regulated in this way. But it has a number of other different regulatory factors as well. So one of the key points that I like to point out is that in the brain, you have, it's located in postsynaptic. CB2 receptors are intracellular as well as being on the surface. And they are contained in the microglia. And with the microglia, they are deactivating the immune cells. And they're shifting the cell from an M1, that's the active phase, and the inflammatory phase, over to the M2 phase, which is a resolution phase. So it doesn't turn off the immunity. It switches over to a monitoring and a resolution phase. So it's still active, but it's not in the sense that it's not creating inflammatory substances. It's also highly effective as a nerve growth factor for stimulating neuritogenesis and nerve linkage for cells. And it also works as arginase 1 activator, so it's actually producing nitric oxide for vascular influence, and it actually produces anti-inflammatory cytokines very specifically. So it's located in the microglia, it's located in the neurons, it's doing a host of different measures in both these areas. So I want to talk a little bit about beta-caryophyllene for pain. So I'm going to talk a little bit about CB2-related mechanisms for pain, and then I'll talk about endocannabinoid-related, antioxidant, and other pathways that connect up for pain. Now, first off, the CB2 mechanisms. We know about its anti-inflammatory effects. We know about its glial effects, and it prevents glial activation, and it prevents macrophage activation. So these cells are going to calm down. They're not going to get active. They're not going to be invasive to tissues, and they're not going to create inflammatory environments. Whereas at the same time, it's actually producing anti-inflammatory mediators, cytokines, IL-10 being the characteristic. But it's also modulating the endocannabinoid tone. So by blocking the degradation of AEA and 2-AG, you're getting an increased levels of these endocannabinoids, which can only be good in our constantly dysregulated endocannabinoid system. Plus, there has been shown some synergy with CB1 receptors, actually. So it's vague, it's not clear, but the studies have determined that there is some CB1 action, and probably that is a result of the AEA and the 2-AG activation from the decreasing the metabolism. Not only that, beta-caryophyllene alone is an anti-inflammatory and immunomodulatory substance on NLRP, inflammasome inflammation, and NF-kappa B suppression. So it's fantastic for this. It's going to suppress these nuclear factors that are going to be activating the DNA of the body and RNA, and it's going to suppress this particular molecule that leads to the exacerbation of all our inflammatory molecules. Not only this, it's actually oxidative stress and redox balance. So it actually controls for oxidative stress very specifically. It's a superb antioxidant. So this involves the NRF2 pathway and mitochondrial protection. So I'm going to get into this later on, but it actually stimulates mitochondria and it protects mitochondria at the same time. And then it is also involved in ion channels and neurotransmitter modulation. So that's a lot like CBD, and that's a lot like THC, but these are very specific, and they're working on the TRPV receptors and ion channels as well as neurotransmitter regulation. So all of these factors play a major role in the modulation for pain, but I've got a couple others that have come to light more recently. Now, so I've got a graphic here that displays the benefits of CB2 activation. On the left, it produces the sensitization of substances from mast and immune cells is blocked very specifically. And because of that, it becomes anti-allergic, anti-allergenic, and anti-nociceptive. So this is an important pathway, and I think I'll get at that briefly, that it's going to work on mast cell activation syndrome very specifically. And then it's also working on the microglia and astrocytes for neuropathic pain. It's working on neuroinflammation. And in particular, it's working on brain-derived neurotrophic factor for improved mood and memory deficit. And then it's also blocking amyloid beta fibers and aggregation, and it's going to protect against Alzheimer's disease and also other neurodegenerative conditions as well. So one of the areas I've learned about more recently is that BCP at the dorsal root ganglia has a major factor in that the dorsal root ganglia is the orchestrator for a lot of neuropathic pain. And one of the specific targets is here is the CB2 receptor. It inhibits this type of reaction. So if somebody's getting a peripheral injury, then that is exacerbated by the dorsal root ganglia to create an inflammatory substance and increased pain, where it actually, Beta-Caryophyllene actually stimulates the substance P release in the dorsal root ganglia, and it modulates the glial cells very specifically to reduce that pain. And it also CB2 actually stimulates beta endorphin release in the DRG. So it's reducing pain at all levels, which explains why it is so superb for neuropathic pain. So this is a gentleman who has bilateral lower arm amputations from a power line rescue of his father. He was age 10 when it happened. He's got stump pain, and he hasn't found anything to relieve that. He's also got phantom limb pain. He used the BC Plus gel on it, and it's the only stuff he's ever found to relieve his pain. So I was really impressed with this, and I think it relates to the dorsal root ganglia mechanism, but it could also relate to phantom limb pain as well. So I'm hopeful that I can get some clients in on board, and I've used it in another person with phantom limb pain to great success as well.
Jim.
So beta-caryophyllene for pain. So these are the mechanisms that I see going on. It's neuroprotective, it's anti-inflammatory, it is vascular regulating, it's metabolic, it's neurotransmitter regulating, and it's behavioral. So this is hardly the things that we talk about, and the general guidelines for beta-caryophyllene make this a huge factor in the benefits for the body. So the effects on the brain, particularly, we talked about regulating the endocannabinoid system, but also promoting neurogenesis. And so it also it generates neuritogenesis, or the formation of axons and dendrites, as well as creating other nerves. And it shifts the microglia to the M2 resolution state of the body and the inflammatory cells. So it's resolving the inflammation of the brain, and it's restoring the blood-brain barrier impermeability. So when we get an injury of any sort, we're going to get a breakdown in that permeability, and the vascular nature of the brain allows it to leak a lot of fluid. If taking beta-caryophyllene will restore that blood-brain barrier to its impermeability and prevent these toxic reactions that we get from our general circulation. It's also regulating proteostasis, which is the malformation of different proteins in the body, like amyloid beta into tau and synuclein. And it also promotes autophagy. So it's autophagy and mitophagy at the same time. So you're getting a breakdown of these disordered cells and these old senile cells, as well as a clearing of them and a generation of new cells that can be highly protective. It also prevents tau tangles and neuron degeneration through amyloid beta, and it increases the mitochondria formation and function. So I created a little diagram here to show you the dementia model for the reversal of beta-caryophyllene. This was a study done in some rats that showed a significant improvement in their cognitive and of their functioning capability. And it came about through the anticholinergic effects of beta-caryophyllene, as well as the antioxidative damage and the increased brain-derived neurotrophic factor as well. And it also has other factors that are here connected, and the anti-inflammatory properties as well. But all of these things were manifest as an improved cognitive functioning of this model of dementia in rats. So this is a real-life example of a 94-year-old Marine Corps veteran and a chopper pilot who was placed in hospice for neurodegeneration 6 months ago for memory loss and paranoid ideations. He had extreme fatigue and immobility, and he was bizarre in his behaviors. Beta-caryophyllene and a ketogenic diet was invoked, and we introduced him to better appetite. It improved his, reduced his agitation, his ambulation, and increased engagement to the point he recorded a 2-hour interview of his life military experiences to the Library of Congress. And after a few tweaks of his medication, he's off hospice, he's driving again, and he's actually preparing for a helicopter simulation experience. So this is no exaggeration. This guy has been transformed. Now, did he have Alzheimer's disease? Probably not. Probably it was a manifestation of a deterioration of his dementia from metabolic issues or from his medications. But those medications were dragging him down to the point where he was not able to function. And BCP actually restored his function within a matter of minutes after getting a dose. Now, for Parkinson's, the literature is replete with preclinical evidence for beta-caryophyllene protecting Parkinson, dopamine-producing cells in the substantia nigra. There's a number of different articles, and so I was intrigued with this, and I started treating a number of people, and I've seen incredible results where I've reversed many of these symptoms almost immediately. Both the motor and the non-motor symptoms can be reversed in many people, even after years of Parkinson's disease. Now, it doesn't happen for everybody, but it does happen in a significant number of people, and it has fabulous to see this sort of a response and get people on board with it, because I think that it's going to be protective against their further deterioration. So I don't think that we're going to be able to reverse all of the symptoms, but if we can stop the continued deterioration, then we're going to prevent deaths, and we're going to improve their function, and we're going to improve caregivers' life at the same time. So one of the strong points I feel about beta-caryophyllene is for anxiety and depression. I've seen such spectacular response for this. I really want to go into this a little with some depth. So the depression is, I feel, a combination of a blend, a spectrum of stress, anxiety, and depression. Is all the same thing. It's all caused by pretty much the same, but it's different degrees of each. And so I approach it in that way. So one of the things that causes depression is a lack of relaxation, lack of socialization, a lack of sleep can all put incredible stress on the body, which increases cortisol and adrenaline and creates an inflammatory environment that leads to neuroinflammation, and I think it leads to cytokine release and breakdown of the blood-brain barrier and a number of other problems that we see chronically in people. So one of the factors that beta-caryophyllene could be absolutely restorative in terms of reversing those cytokines and restoring a healthy brain from reducing neuroinflammation. In addition, there's definitely factors of brain-derived neurotrophic factor. And then here's an interesting one, has to do with the CB2, a heteromere, CB2 receptor, and GPR55. Now, I'll talk about that in a few moments. So the evidence here is that anti-inflammatory drugs actually ease depression in many cases. and the fact that combat stress training increases blood-brain barrier permeability and induces immune activation. And so that indicates that the blood-brain barrier is susceptible to stress, and that we could modify that with beta-caryophyllene and reducing that stress and reducing the permeability of that membrane and restoring and preventing depression as well. So the brain-derived neurotrophic factor is a key element in psychedelics. It turns out that ketamine and SSRIs all bind to the BNDF receptor TRK bravo, and they activate the brain-derived neurotrophic factor. But LSD and psilocybin activate it to such a degree, it's almost 1,000 times the activation potential of SSRIs. So it's giving a huge bolus to the BDNF that could be symptomatic and could be restorative, and that could be the factor that is restoring so many people from their chronic depression in many cases. BDNF stimulates autophagy and neuroplasticity to act as an antidepressant. So it's got huge potential in this way. But you know, there's problems with this particular therapy. Ketamine and the psilocybins and the psychotropics, they have to be submitted. Generally, they have to be supervised. But beta-caryophyllene is over the counter. And yet I've seen people reverse depression in a matter of minutes after using BCP. So basic beta-caryophyllene improves BDNF. It improves the TRKB, and it improves a number of other factors related to these receptor systems promoting BDNF. So it could be an alternative to using ketamine or psilocybin or LSD to orchestrate a therapy for severely depressed or chronically depressed people. And that's included I want to get to the factor that in suicide. So in suicide, there's BDNF is also located, is low, but here is a factor that I was unaware of until recently, is that there are, in suicide victims, they have high levels of CB2 slash GPR55 heteromeres that are activated in them, but they don't have any way to activate that. So that, and CB1 receptors are very low in these individuals. So when they examine this, 18 suicide victims, they had very high levels of expression of CB2 and GPR55. Well, they had normal levels of these particular molecules alone, but when they examined them as a heteromere, they found that there were high levels in the prefrontal cortex of victims. And so the alterations in the CB2 and GPR55 expression in the prefrontal cortex suggests a link to impulsivity and decision-making in suicide victims. And so this has a huge potential for working with individuals. Now, I don't have specific evidence for beta-caryophyllene working on this heteromere, but if you activate CB2, you're going to activate GPR55 in this heteromere. And that could be the opportunity. Now, this particular heteromere is active in cancer and in a number of other areas as well throughout the body. And GPR55 in an active phase relieves pain, it orchestrates bone health, metabolism, cancer, and modification, modulation, and neuroprotection. So it's a valuable factor. But THC as a negative activator of GPR55, and CBD is also a negative activator of GRP55. So then BCP has the potential of correcting for this very specifically. So I want to give you a history of a woman who I had started on this. And this was an image that I took of her with 10 minutes after her first dose of beta-caryophyllene. And she says that I recently spent 2,000 pounds on a private psychologist session after session of her telling me to walk away from my family and put myself first. 10 hours later, I met you. I stopped therapy. I stopped the SSRI, not because I had planned to do so, but because I realized I didn't need it anymore. I felt different, not just better, but clearer, stronger, braver. And there's a richness to life that I hadn't felt in decades. I've weaned off the antidepressants. I've been on since I was 13 years old, now 39. I feel lighter. So that beta-caryophyllene didn't just help me manage my symptoms, it amplified my inner healing processes. I feel more awake, more alive, and more at peace than I thought possible. And I've got this YouTube actually is available as we speak. So beta-caryophyllene for metabolism. Now this is a unique area that I'm really excited about, and I think it has a great deal of value. The value it has is that it not only has to do with the metabolism of the body and being overweight and handling your calories, but it also has to do with inflammation and mental health as well. So beta-caryophyllene actually activates both PPAR alpha and PPAR gamma. So CBD activates PPAR gamma, but it does not activate PPAR alpha, and that's where beta-caryophyllene kicks in for a double home run. So the the PPARs are in the brain, and they regulate energy and homeostasis and metabolism. So they are anti-inflammatory and neuroprotective compounds. They employ synaptic plasticity and cognitive function, and they regulate the neurotransmitter systems. They are targets for neurological disorders such as Alzheimer's, Parkinson's, Huntington's, and they have potential for schizophrenia and depression. So they work in all these different areas. They're across the body, and they're also controlled by genetics. These are nucleic factors, nuclear receptors that activate on a combination of different elements, and they produce a whole bunch of RNA and different modifications for the body that encompasses cancer, autoimmunity, liver disease, diabetes, and adipose tissue changes very specifically. They also affect learning, memory, neuroinflammation, pain, and addiction. So one of the things I want to point out is that beta-caryophyllene, by activating these two receptors, combines a double whammy on the metabolism. So it's going to activate the PGC1A, which is a linkage cofactor that activates a number of different responses in the body for mitochondrial biogenesis, actually making more mitochondria. And it's going to invoke fatty acid oxidation. So it's actually going to improve the oxidation and shift the body over to oxidative phosphorylation. So it's going to generate a great deal more energy, and it's going to stimulate glucose metabolism. So it's going to generate more energy from the glucose metabolism, but it's going to facilitate the absorption of glucose into the body, and it's going to get away from the fat deposition part of what's going on. So in this particular study, beta-caryophyllene alleviated diet-induced neurobehavioral changes in rats in the role of CB2 and PPAR gamma receptors. And so these are some of the highlights: the improved behavioral derangements. This is neurobehavioral is very important here. It's amazing that it is affecting the metabolism as well as the behavioral arrangement. It ameliorates insulin resistance, exerts antioxidants, it's neuroprotective, and it actually activates the PPAR gamma, cofactor 1A in the prefrontal cortex. Now that's the area of the brain is associated with the BDNF and the CB2 GPR55 that has to do with impulsivity and suicide. So if we can get that area of the brain to thinking properly and performing different decision making, then this could be a major factor in improving our whole substance, our whole decision making, and prevent actually food addiction in many people. So one of the areas I've explored is beta-caryophyllene and a GLP-1. It turns out that in a study done a number of years ago, in actually 2023, was done on GLP-1, and they were testing a GLP-1 called liraglutide, Victoza is the common name. And in this particular study, the beta-caryophyllene exceeded the benefits of the GLP-1 by almost 50%. And so there was a greater weight loss with the GLP, the beta-caryophyllene, than with the GLP. And they lost 10% of the weight during the first, I think it was 4 weeks that was done. So this is an incredible result, and it's incredible potential that it could have on stimulating GLP-1 and reversing so many of these adverse effects that we're encountering with the high levels of GLP-1, such as Ozempic as well. So I've got a couple individuals who lost, these were people who were not trying to lose weight. So they lost, this one was 279, she now weighs 267. She lost 12 pounds almost immediately with the dosing. And then another person lost 13 pounds, and another person lost 45 pounds over a period of about 3 years that she had been taking beta-caryophyllene in low doses, and she didn't know about these particular benefits at all, but she realized that she was successful at losing weight from it. So I've had individuals lose as much as 75 pounds. Now, I recommend that you, if you're using the products, the beta-caryophyllene, or the capsule we have, a metabolic blend, that you combine it with a low carbohydrate diet, because that is the magic that gets everybody into good shape. Now, I'm going to touch upon a couple subjects here just to give you an orientation for sleep, addiction, mast cell, and cancer, but just a few words on it. Beta-caryophyllene is superb for sleep. It increases the depth of sleep and the duration of sleep. You have a great deal of deep sleep factors. You get a 20 to 30% increase in your deep sleep, and you sleep longer. It has a profound effect, even if it's taken during the day and not right before sleep. Addiction. Beta-caryophyllene is anti-addictive for everything. Everything. It's cocaine, nicotine, methamphetamine, opioids, you name it, THC, and food. It's actually anti-addictive for food behavior. So it has a huge potential in this way, and I highly endorse it. It doesn't, you need to include it with a behavioral program to stay away from those triggers, but this is a great thrust to get away from the cravings and to treat the withdrawal symptoms. So often I've treated many patients who have been on benzodiazepines or SSRIs, and they get withdrawal symptoms. And I just have them take additional doses of beta-caryophyllene to counteract those side effects from those substances, and they do extremely well, and they get off of those drugs very quickly. And mast cell activation. You know, this is we're not recognizing this quite now. It happens in about 18% of the population. It is a terrible afflictive agent that has to do with the activation of these mast cells that are at the periphery and they're at the transition point for the body. They're in the lungs, they're in the skin, they're in the bladder, and they are designed to register for infection and invasion, but so often they get out of balance, and they are covered with all these different receptors and antibodies. But if they get activated, and so many people get these activations, that they are incapacitated. They're incapacitated for a number of different problems, including endometrial implants have contained in it, and anaphylactic shock. So I've actually inhibited anaphylactic shock with beta-caryophyllene, because beta-caryophyllene actually blocks the CB2 receptors on these cells and triggers an anti-inflammatory response, and people can continue their lives without these types of reactions. And then cancer. I just saved it for last because beta-caryophyllene has an enormous potential for cancer. BCP should play an important role in all aspects of oncology, including prevention, adjunctive care treatments, and symptom control, as well as recurrence protection. And here's the second part of the slide, where I go through a number of different elements. It has huge potential in this area, and I wish that it could be used more as well. So that's the story. I mean, the beta-caryophyllene is a natural food substance. It's got a broad spectrum cannabinoid. It's a phytocannabinoid by official designation. It's FDA accepted, a low dosing, few adverse side effects. In fact, I have not really identified any. Synergistic with cannabis, and it's an alternative to cannabis products, and it's established effective liposomal format. So I've put it into a liposomal format for its bioavailability. So I really like to target particularly people who cannot usually take cannabinoids. And so your first responders are a very high level that I'd love to get on board because it handles their stress as well as their inflammation and their mental acuity, and it helps them deal with the pain situations that invariably they are under. So the beta-caryophyllene liposome is the premier product. It has a huge palatability. It has so delicious. It's highly bioavailable. It's liposomal. It gets absorbed within minutes. It has oral and topical use. You can actually use it topically as well. 10 to 30 milligrams of beta-caryophyllene sublingually, synergistic with CBD, no significant adverse effects. It's clove-derived. And these are some of the effects that I get when people take this. And I have them hold it in their mouth for 1 minute before they swallow and swish it. And in that swishing time, then I check them. I have them do a pre-assessment beforehand, and then I pre-assess, and then I have them do assessment after 10 minutes. And invariably, they have improved vision. They have deeper voice and stronger vocalization. Their facial muscles relax. They get into a laughing mood. They get a smile. They get deeper breathing easily. They get a cognitive clarity and memory, and they get task-oriented. And their joints increase their range of motion, and they get relief of fatigue and pain. And this all happens within about 10 minutes for many people, not everybody. And so I've got a couple examples of the dosage this is a 6-year-old autistic who takes a beta-caryophyllene as his, quote, brain food. Whenever he gets upset, he takes a dose and he's all calmed and he's interacting with his peers at that stage. And then I've used it in police dogs as well, and it's been effective for canine arthritis and anxiety from the dogs as well. I've also got a gel product, and this is a little thicker. It's a cream. It has a combination of different beta-caryophyllene and other terpenes that is highly effective, and that's the one we used on the amputation. It's highly effective for pain, but it's also effective for skin irritations, and it actually improves the skin texture and moisturizes, and it can relieve wrinkles as well, and it's changed the complexion on many different people. And then I've got the tincture, this is a sort of raw oil with a number of other terpenes in it. But this is unique, and you can put this on your skin anywhere, and I usually have it in a spray bottle, and so I spray it on where I've got an ache or a pain, and it lasts for 3 or 4 hours. I get great relief for symptoms, but I also use it as an inhaler. And so it's an inhaler with from the volatile BCP. And so I won't go into the details, but these studies have outlined the benefits of inhaling beta-caryophyllene in that it actually went to from a small amount that was undetectable by normal odors, it went to the lung, olfactory bulb, brain, serum, heart, liver, kidney, brown adipose tissue. And then another one incorporated into aortic wall, improved nicotine-resistant stiffening of the aorta and damage from nicotine. And in another one, it was used in 48 people with a blend of different products, and it produced happiness and decreased the ratio of fear. And this was just a very small amount of taken into a vaporizer or a diffuser. And then there were 19 women who used 3% vapors for 20 minutes. They increased their salivary testosterone, but not estrogen. And then I had another study where they're using different odorants and they had a 226 improvement in verbal learning and improved skills with it. So you can use it from different inhaler devices as well as a diffuser. I've got the immunity blend as a capsule. It's got 15 milligrams per capsule. It's combined with turmeric, so it has great anti-inflammatory properties, and combines for the curcumin are excellent. And it's got improved bioavailability with the black pepper extract. And then I've got the metabolic blend. It's got 30 milligrams of beta-caryophyllene per capsule, and it combines with oleol ethanolamide, which we know is an endocannabinoid, very specifically substance, and it has amazing properties on different aspects of the diet. And so it can control appetite very specifically, and it actually activates oxytocin. So you're getting a great deal of relief and again, a warmth and feelings of association and socialization with that. And then finally, this is the wrap-up slide, and this is all I've got. I want to invite you to try the products. I'll answer any questions that you have. I see beta-caryophyllene as being create a balance and complement health through the endocannabinoid system, and that's my thrust. Is I'm trying to treat people's endocannabinoid system very specifically for health and their well-being. So thank you very much for taking part in my lecture. Thank you.